Hello and welcome to Askimo TV. I'm talking today to Dan Smith. Dan is the Director of Sports and Spinal Physio in the UK and is the lead physiotherapist. Hi Dan, how are you?
Hi Joanne, I'm very well, thank you.
Dan, we're going to talk today about Achilles tendinosis and frequently asked questions that people may have about it. So I'm going to start off with, what is the Achilles tendon and what does it do?
Okay, Joanne. The Achilles tendon connects the calf muscles, the gastrocnemius and the soleus, to the heel bone at the ankle. And when it contracts, it pulls the heel bone up and points the foot down. So in daily life, this will be useful in situations where we wanted to push off or go up onto our tiptoes.
What is Achilles tendinosis?
Achilles tendinosis is effectively a chronic, long-standing problem with the Achilles, where the Achilles becomes thickened, painful, and degenerative or worn.
What are the main causes for this injury, and what are some of the signs and symptoms that somebody might experience?
The most common cause of Achilles tendinosis is faulty foot or leg biomechanics. This is normally due to the way the foot is structured, effectively. After that, we have problems such as poor footwear, poor training techniques, increase in distance or mileage too quickly. The symptoms essentially are pain and swelling and normally a thickening around the base of the Achilles.
How is Achilles tendonitis diagnosed and treated by the physiotherapist?
Essentially, it's diagnosed by an examination. We have a look at the Achilles. If it's tender and feels thickened, and the patient reports pain, normally pain when they're walking, or particularly when they're coming downstairs, we can normally assume that it's an Achilles problem. Now, if it's long-standing, then we would normally class this as a tendinosis as opposed to a tendonitis. In terms of treating it, the most common way of treating this is through a program of exercises which we call eccentric loading exercises. After this, we advise the patient on footwear. They may have to wear an orthotic device in their shoes. We will address their biomechanics with exercises, so the core stability type exercises, and they may get some stretches to do for their calf muscle too.
How long does healing take, and is there ever a need to resort to surgery?
Well, the healing takes different times in different people. It depends on the length of time the person's had the problem for. Essentially, a tendon cell takes about 4 months to become fully mature. So the exercises that we do are aiming to promote healing in the tissue. So we're looking at about a minimum of 4 months, but sometimes it can take up to 12 to 18 months for Achilles tendinosis to completely heal in certain people. In some cases, the patient might develop an ingrowth of blood vessels or nerve endings into the Achilles. We call this neovascularization, and this will require a series of injections. And in really extreme cases, the tendon may require stripping out surgically to promote healing and to remove the diseased tissue.
What, if anything, can people do to avoid getting Achilles tendinosis?
The main thing is to train sensibly. If they don't increase their mileage too quickly and keep track on their training programs, they should be okay. Correct footwear is always a good one, making sure they've got the right running trainer. So seeking the professional advice from a physiotherapist or a podiatrist is always useful. And then keeping the calf healthy through training techniques, so strengthening and stretching programs. All this can be carried out in conjunction with the core stability exercise program to ensure the rest of the body is functioning normally as well.
Thank you, Dan. Thank you so much for talking to me today.
You're welcome. Thank you. Goodbye.